Good afternoon. Thank you so much for those who are dialing in. It's so great to see so many people who have RSVP'd. Thank you so much. We'll get started in 1 minute as we let attendees come in. Thank you. Great. I think we can get started. Good afternoon. I am in Washington, D.C., so it's 1 p.m. Eastern time, but wherever you are around the country, we're so grateful that you've joined our first Regional Champions webinar for the year. Happy New Year. I hope everyone is doing well and is safe and healthy and had some rest during the holidays. I want to thank everyone again for being so dedicated to the work that the Reeve Foundation is doing. We have a lot of great updates and a lot of huge successes that we had last year. And I want to thank each of you for being a part of that. We can't do this work without you. And for those of you who may be new, please reach out to us. We'd love to get to know you. We'd love to have you more involved in our advocacy program. So we can get started with our first slide, please. And I can quickly introduce myself for those who don't know me. My name is Kimberly Beer. I'm the Senior Director of Public Policy and Advocacy at the Reeve Foundation. As I mentioned, I'm based in Washington, D.C., and we work with an amazing team here at the Reeve Foundation on all of our grassroots and federal advocacy issues. For those who are familiar with our program, we often meet with our regional champions and those interested in advocacy and give them updates. So this is the first one of the year. And as I mentioned, the end of last year specifically was very, very busy in Congress. So we'll have a lot of updates and a lot of the work that impacts the Resource Center specifically. So this is our agenda, and we're happy to go to the next slide to talk about our panel. This is our mighty team here. Many of you know Gerard. Gerard is our grassroots advocacy manager, and he takes hours getting to know each and every one of you. And so again, if you don't know Gerard, please reach out. His contact information will be at the end. So grateful for my colleagues and their expertise and their time. And I think we can go to the next slide, please. Before we get started, and of course, acknowledging a lot of our huge successes last year and the work that's set out that we have to really accomplish this year, there's a lot of challenges ahead, but I know we're going to be successful. I wanted to acknowledge some huge losses we experienced last year from some extraordinary disability activists and friends of the Reeve Foundation and the paralysis community. And I know many of you are familiar with the work of Judy Heumann. Of course, she was a powerhouse and the mother of disability rights. And we were so sad to lose her early in 2023 and want to continue to honor her legacy and the work that she started or carried on many, many disability activists to improve the lives of people living with disabilities and protecting them under federal law. So we want to acknowledge her contributions, but also acknowledge that we lost her, and we're coming up on a year of her anniversary of her passing. A second friend of the foundation, and of course, friend of the ALS and disability community, is Adi Barkan, who is not only an activist, but co-founder of Be the Hero Fund. He was an extraordinary human being. We lost him at the end of late last year. He dedicated his life after receiving an ALS diagnosis to raising awareness around the cost of healthcare and caregiving specifically. And he worked with the Reeve Foundation closely on advancing not only that advocacy priority, but also raising awareness with us, with members of Congress, around the high cost of caregiving, especially those with complex needs and sometimes 24-hour care. So we will greatly miss him. And if you haven't, there was a wonderful article in the Washington Post. We can include it in our follow-up. His wife wrote an op-ed around not only his work, but also carrying on the legacy of ensuring that the United States faces our caregiving crisis. So we will miss him. And finally, my personal friend, and of course, a friend of the foundation, and many of you know Andres Gallegos, who passed away in December. And I have to say, honestly, I was shocked, and I'm going to miss him immensely. He was the chairman of the National Disability counsel, but he had a long, decades-long history of disability activism, especially as a legal expert and lawyer protecting the rights of those living with disabilities. He lived with paralysis and was an extraordinary human being who treated everyone with respect, included all voices, and worked diligently to expand access for people living with paralysis, but also their medical needs. He really saw all of the inequities that continue to exist around individuals accessing not only proper healthcare from informed providers, but also the physical aspect of getting into a doctor's office, getting the screenings and the proper care that everyone deserves. So we will also miss him immensely. And I just wanted to honor those three activists. Next slide, please. I think I'll now pass it over to my colleague, John Sawyer, who will give us some updates. We activated many of you at the end of last year, and I know John has some updates for us.
Great, thank you so much, Kim, and thanks to everybody for being on the webinar today. It's a really active time here in Washington, D.C., where some crucial decisions are being made in the coming weeks, and those decisions directly impact the future of the Paralysis Resource Center and the Reeve Foundation's ability to continue operating that resource center. And so we're really, really grateful that all of you have been active advocates, and hope that you will continue to do so, because this is crunch time in many ways. So we're going to start with where things stand on government spending and the process known as the appropriations process. This, as you all, if you've been on these webinars before, you know, is the process by which Congress on an annual basis determines funding levels for thousands and thousands of federal programs, everything from, you know, a range of healthcare programs to veterans programs, agriculture, transportation, housing, and of course, disability programs as well. So the focus that we as the Reeve Foundation team and advocates hold within that process is to focus on the Paralysis Resource Center. Every year, Congress determines the amount of funding for the Paralysis Resource Center. And in recent years, we have been excited to see that Congress on a bipartisan basis has sort of incrementally increased funding for the Resource Center. So we'll talk about where things stand on the PRC funding in just a moment. But just to look at the bigger picture, Congress is supposed to finish its business for the current fiscal year before that fiscal year starts and set the funding levels for the fiscal year ahead. That typically hasn't happened in recent years, and Congress continues to sort of give itself extensions to finish the work of setting these funding levels in all these funding bills. Currently, Congress is under one of those extensions, a stopgap measure called a continuing resolution, where basically all government funding is on autopilot until a date certain. And in this case, that date is actually split depending on which programs you're talking about. And so the funding bill that covers the Paralysis Resource Center and other healthcare programs and disability programs is known as the Labor HHS Education Bill. That includes HHS, the Department of Health and Human Services. Funding for that agency and therefore for our program is extended until February 2nd. It looks like Congress may give themselves even more additional time. There are conversations happening right now about whether they can actually finish the work that they have in front of them by that February 2nd deadline. So we may not see this process finish up until closer to late February or even early March. But what is important to know is both the way this works is that Senate proposes a level, the House proposes a level, and then depending on how much overall money the whole government has to spend, those Senate and House levels are reconciled. And in this case, that's a very important dynamic as far as the PRC. So the Senate, which released its bill partway through last year, did exactly what we hoped they would do, which was continue to fully fund the Paralysis Resource Center for next year, for the fiscal year 2024. That was the foundation's request. That's what we were hoping to see after several years of small increases. And in a tight budget environment, we requested level funding, and that's what the Senate bill includes. The House took a different path in what they proposed. So unfortunately, the House, driven largely by the more conservative members of the Republican majority, decided to cut the overall amount of funding that would go into these bills. And that overall cut trickled down to some extent, and they proposed a significant cut to the Paralysis Resource Center. That cut amounts to about $5 million. And if it were enacted, would cut PRC funding in total by about 50%. Right now, the PRC is funded at just over $10 million. So a $5 million cut would really devastate some of the ability of the PRC to continue operating the important programs that it does. So that both of those, the House proposal and the Senate proposal, are just that at this point. They are proposals. They are directly tied in some ways to the decisions about the overall amount of money that Congress will spend in domestic spending and defense spending in the year ahead. The good news is that a deal has been cut on those overall levels, those big, what are called top line levels here in DC. And those levels mirror much closer to the Senate levels. So we're in a good position heading into the final stretch here to argue that because they have the more money available in terms of the large pot of money, that they should stick with the Senate approach on the PRC itself and continue to fully fund. So that is the advocacy work that we are doing now. Kim and I spent a lot of December walking the halls of Capitol Hill, meeting with the key offices, emphasizing to them the importance of the PRC, but also emphasizing what the impact would be of a cut of this magnitude. I think we had good reception, but it is going to take an effort that involves all of you weighing in about the importance of this program to get us over the finish line here. And so as of right now, an agreement must be made by February 2nd to avoid a government shutdown. If they pass another short-term extension, they can keep going. But again, we're hoping that these decisions will be finalized in February. When we talk about a government shutdown or we talk about these deadlines, it's important to remember that the PRC itself and the program is operating using last year's dollars. And will be operating last year's dollars until this coming July. So there is not an immediate impact, even if there is a cut on the PRC operations, or if there's a government shutdown, the PRC itself and the team, the information specialists, the program staff will continue operating, even if there were to be a cut or a government shutdown, at least in the coming months. But what we're talking about here is the next fiscal year, which would start to take effect after July. So Gerard is going to talk more when we get to the grassroots section about all the different actions folks can take, summarize some of the different actions that we as a team have taken. I think that may actually be on the next slide, so I can run through that if we go to the next slide. But I want to emphasize here that this is a group effort, and weighing in with your members of Congress about the importance of the PRC is really critical. So just to cover some of what we've been doing beyond actually walking the halls and meeting with members of Congress directly, we have an action alert that's been live in the field. Gerard will give you a report on how many people have taken that up, but it's a lot, and we're hoping for more. The foundation immediately released a statement outlining how devastating this proposed cut from the House would be. There's a letter going to all members of Congress, I think as soon as this week, laying out the importance of the PRC and the potential impacts of any cut. We've been coordinating very directly with partners and at the national level, other groups. The Limb Loss Resource Center is operated by the Amputee Coalition. They were also proposed to see a cut. We've been aligning our efforts very carefully there, but as well as across the board with disability and other patient advocacy groups. This was by no means the only program that the House bill proposed cutting. There were major cuts proposed to the National Institutes of Health, to the Centers for Disease Control and Prevention, to other public health functions, kind of across the board. And so there's been a real outpouring of action by the healthcare community, and the foundation has been part of that. And of course, the direct outreach that I mentioned. So I'll let Celicia move on, but I think just to say that it is a really important time to be active, to be engaged, to be in dialogue with your members of Congress, their staffs, about the importance of this funding. In the bigger realm of congressional funding and appropriations, $5 million is, as they say, a drop in the bucket. But that also means it can be easily overlooked. And in the context of the PRC itself, it's really, really critical. So we appreciate you being here today. We'll give you some action steps and marching orders later in the presentation. But for the moment, I'll turn it over to my colleague, Celicia Lomax, to talk about some transportation issues that are still active and live.
Thank you so much for that, John. And again, as he mentioned, there will be more that we discuss later on as far as grassroots opportunities, but did want to talk about another really important priority and fast approaching deadline, which is the FAA reauthorization. So just for a little bit of background, again, every 5 years, Congress is meant to pass an FAA reauthorization bill that broadly spelled out is the Federal Aviation Administration, and it includes funding for things like airport planning and development, for facilities and equipment, and thinking about workforce development broadly for roles such as pilots and air traffic controllers. And right now, the funding is currently set to expire on March 8th, which is very quickly approaching. Although that reauthorization bill was set technically for 2023, there have been several extensions, and part of that is due to disagreements that are ongoing within the Senate. And so to date, so far, the House last summer passed a bipartisan FAA Reauthorization Act, but the disagreements in the Senate are primarily focused on safety and pilot training requirements. That namely is looking at whether or not simulation-based pilot training is sufficient for pilots moving forward, and that's part of what's causing the delay. I know several folks may have seen this in the news recently too, with Alaska Airlines and the door that came off of that plane mid-flight. It's actually brought FAA reauthorization more so back into the spotlight, and another urgent issue that members of Congress are refocusing on. So we know that several policymakers and advocates have expressed this interest in a long-term FAA bill and not just an extension of what already exists. Part of that was heard within a recent hearing by the House Committee on Transportation and Infrastructure in November of last year, but those conversations are ongoing. And so part of why it's so important to have this new reauthorization bill is because there have been current proposals made that include several disability-related provisions. Some of that is language around training for staff and others, especially when thinking about equipment and some of the many stories that we heard from you all actually related to transportation and particularly air travel. It also includes penalties for failure to meet some of those new standards. And so it's really important to have a new FAA reauthorization bill as opposed to a simple extension throughout this year. And so our team will continue to monitor this as we get closer to March. We'll see what those negotiations will look like, but we're really hoping that these newer proposals that have been made will be included in that bill. And so I think I will be passing it over to Angel now.
Thank you, Celicia. Hi, everyone. I am going to just give you a few brief updates from our coalitions that we partner with, just updates on some of our wins and things we've been working on this past year as a reminder. So if you want to go ahead and go to the next slide. I'll start with the 50th anniversary of the Rehabilitation Act with proposed updates to Section 504. We talked about this briefly, I believe, in our last Regional Champions webinar. But I just wanted to do a reminder that this year marked the 50th anniversary to this act, and it was the first time these proposed updates to Section 504 are the first updates to this section, and now almost over 46 years. So we were very thrilled with the proposed rule on prohibiting disability-based discrimination and health and human service programs and activities. So these things would prohibit discrimination in medical treatment, including when a disabled person needs an organ transplant or life-saving treatment. We feel very strongly about ensuring access to medical equipment, including exam tables, and diagnostics. We hear from our community members on this issue a lot. So we, the foundation, we submitted comments on the proposed updates to Section 504, as well as we signed on to Joint Coalition comment letters. And also want to just thank you all, because I know that some of you, our champions, also submitted comments during this public period in the fall. So thank you. We also signed on to various coalition comment letters that raise concerns about the Census Bureau's proposed changes to the 2025 ACS survey. This would questions, it's regarding assessing disability status. So the new questions would propose, the new proposed questions that assess disability status would extremely diminish the number of people that are counted that live with disabilities. So we definitely had concerns with the way these questions are written, and we submitted some comments on these proposed changes. So we will keep you updated on that. And also, I just wanted to provide an update on the standing systems update that we've been working on with the Item Coalition. We are working with them to submit clinical evidence to CMS so that we can get a renewed request for a national coverage determination to be opened. So this NCD would propose to expand coverage for power standing wheelchair systems, similar to what we have worked on and had a win in with the seat elevation. So we will definitely keep you posted on that, because we will want to take action again to ensure coverage for all of our community members that need the power standing systems. Next slide. I also just wanted to talk a little bit about our caregiving legislative updates. One of our priorities was caregiving this year, and we continue to urge Congress to prioritize caregiving and all of and caregiving solutions for the paralysis community. So I just wanted to share some of the bills that we endorsed this fall. One was the Alleviating Barriers for Caregivers Act, or the ABC Act, that was introduced by Senators Markey and Shelley Moore Capito. And this would really help to alleviate all of the paperwork, all the administrative burdens that we find when dealing with CMS and SSA for people that have Medicare, Medicaid, and Social Security programs. And then there's also the HCBS Relief Act, and this was introduced by Senator Casey, and this would provide dedicated funds to states for more HCBS care workers and additional funds that are much needed to support family caregivers. And we also signed on to a few caregiving focused letters this year. One, in the spring, we did a thank you letter that was led by AARP, thanking the Biden administration for their executive order to strengthen the support out there for family caregivers. And we also sign on appropriation letters for funding that's allocated to support family caregivers. And another letter that was led by AARP on caregiving training services in the Medicare physician fee schedule. And finally, for regulatory work, we submitted comments to CMS on the importance of home health aides. And thank you as well, because I definitely know that there were many of you that also submitted comments this summer on the importance of home health aides. And the last thing I just want to say is this is so important to everyone here at the Reeve Foundation. So if there are any regional champions out there that want to talk more in your community and help to organize a town hall or a listening session on caregiving, please reach out to me or Gerard, because that is something that we are very passionate about. And with that, I will pass it over to Gerard to talk about our grassroots.
Well, thank you so much, Angel, John, Celicia, Kim, for giving us a lot of this information. For those that don't know me, my name is Gerard Arnhem. I'm the Grassroots Advocacy Manager, and I'm just thrilled to be with everyone today. We've done so much this past year, and I just want to share quick highlights with everyone. So let's go to the next slide. So 2023 Grassroots in review. These are just some statistics for our online advocates from our online Advocates for Change platform. But in 2023, we had over 1,500 advocates and regional champions take action on our action alerts, which led to over 4,000 emails sent to legislators on Capitol Hill. This number includes emails to representatives and senators' offices. We also had a 11.39% increase in online advocates for change join our efforts this past year. And currently we just have over 11,000 advocates nationwide. So thank you all so much for being part of this grassroots advocacy platform. And we're still striving for that goal of 12,000 online advocates by the end of this year. So it is important that who's ever watching, please sign up. You can do that by going to our website, clicking on the Advocates for Change page, Advocate for Change page option, or you can text the word advocate to 52886. And you'll receive a text message for you to sign up on that link, and you'll be able to be a part of our growing grassroots platform. On the final bullet, the second bullet point is very special to me and my team. Our Regional Champions program has grown so much in 2023, and it's about a 31% increase from 2022. We currently have 77 regional champions nationwide in 28 states. We still have that overarching goal of gaining a regional champion in each of the 441 congressional districts. So I'm confident we can do that. We could start by getting a regional champion in one of each of the 50 states and territories first, but definitely we can reach that large goal of 441. Some of the top issues we advocated for this past year, Angel was talking about a few, but through our action alerts, it was protecting PRC funding, air travel, and caregiving. And we'll continue to advocate for these pressing issues that impact the paralysis community as we head into 2024. So the next slides are really just going to be to highlight some of our advocacy events we held last year due to increased engagement with our online Advocates for Change and regional champions. So last May, the Reeve Foundation hosted its first ever virtual Congressional Advocacy Day. This event provided just a great opportunity for our Voices for Reeve advocates from across the nation to connect with their federal elected officials, share their personal stories, and educate them on 3 vital priorities affecting the paralysis community on behalf of the Reeve Foundation. So we had over 40 dedicated advocates participating, most of whom were wheelchair users or caregivers. And the day was it was a very impactful day with discussions aimed at improving the lives of individuals living with paralysis, their families, and caregivers. But our Voices for Reeve advocates focused on 3 issues to educate their legislators on. One was to maintain funding for the PRC in fiscal year 2024 at $10.7 million. So that was level funding from FY 23. Co-sponsor and pass the ACAAA, but and support its inclusion to the 2023 FAA reauthorization, which, by the way, we did get some of those amendments put in, but as you heard Celicia talk about, it is still being held up. And also prioritizing, identifying, and adequately funding caregiving solutions in this country. We asked members of Congress if they would be willing to host a town hall or listening session on the topic of caregiving in their district or state. Some of the statistics of the Advocacy Day you can see on the left-hand side of your screen. 42 attendees, 28 states represented, 35 Senate meetings, 31 House meetings. So that was a really big impact. And I do have some pictures to show you. So again, these are just some snapshots of some of our regional champions and advocates speaking with their members of Congress on that day. I was on Team Maryland, so that was we had a great team there. But yeah, we've made our voices heard in the virtual halls of Congress, and we hope to do another one very soon this year. Next up, this is very special. We hosted 3 regional advocacy trainings in different areas of the country. 2 of them were held in person. So one was in Shippensburg, Pennsylvania. The next one was in Abbeville, Louisiana. And then we did a virtual training for the state of Alabama. These were wonderful to attend. We had great turnout in all of them. But really the participants of these regional advocacy trainings gained knowledge on how to engage in the legislative process, become effective advocates for Reeve, while also learning more about the resources and programs provided by the PRC. I do want to highlight that these events would not have been possible without the dedication and instrumental assistance from 2 of our local regional champions. Their names are Jamie Clendenning and Justina Plowden. I put their headshots on screen. So just thank you for helping and assisting and making these events so wonderful. We recognize that the significant impact that education awareness can have in fostering inclusivity and improving the lives of people living with paralysis, their families and caregivers. And there's definitely going to be more to come in 2024, and I'm just very excited to start planning it. So I just want to highlight that event. Next, in September, the Raise Family Caregiver Advisory Council held a full advisory council meeting, which focused on analysis of public comments on the 2022 National Strategy to Support Family Caregivers and updates from federal agencies about their progress implementing the strategy. One of our regional champions, which is seen on the screen here at the bottom, Felicia Gibson, is on the council. And from her experience as a caregiver for her husband after he was injured due to gun violence, she has learned more about spinal cord injuries and how much of caregivers themselves give to assist others. Our team nominated her in 2022 to serve a term on the Raise Family Caregiver Advisory Council, and her nomination was accepted, which we were thrilled about that. And Felicia is very excited to join and to ensure that the concerns and needs of caregivers are known and addressed. For those who are watching and don't remember, last term for the Raise Advisory Council, we had another regional champion. His name is James Murtha. He served on the council prior to Felicia joining. So like I said, we're just thrilled that our Reeve regional champions and through this program have the opportunity to be part of something very important, of this very important caregiver council. So just thank you again for participating and serving. We'll go to the next slide. To round out some of the engagement events that happened in 2023, one of them was hosting our second Regional Champions Coffee Session. It was a very informal session, but the goal of this was to just invite regional champions. Like I said, we have 77 in 28 states to join and just get to know each other, because we're all advocating for the same thing. And it's just nice to know what other regional champions are up to in their local communities. So we had regional champions from Ohio, California, Virginia, Maryland, Pennsylvania. And then we even had one of our special guests that I was able to bring on was Regina Bly, who's the Chief Program and Policy Officer of the NPRC. And then some of my colleagues from the IS team, Christina and Bernadette, were on the call. And we just had a great session just hearing about some of the advocacy activities the regional champions were up to throughout the summer. So yes, I will be planning another one, but so details for the event will come through my Regional Champions newsletter. So if you're on my mailing list, definitely look out for one, because it was just an exciting session and just really nice to get to know everyone there. Now, as John was saying, we have for current action items that you can do. If you haven't already taken action on our current action alert, as you know, Congress has until January 19th and February 2nd to pass a full year appropriations bill for FY24. An email went out last week, I think it was last week, where the action alert was sent out with the link, and it included information which asks our online advocates for change and regional champions to contact their legislators to protect PRC funding at current levels of $10.7 million for fiscal year 2024. We want our elected leaders to know how important the PRC is to the paralysis community, and that any cuts will limit resources and the services provided to individuals living with paralysis. But if you haven't already taken action, you can either scan the QR code on your screen, or you can text Advocate PRC to 52886, and that will send you the link to the action alert where you can take action. As of right now, the action alert has over 1,000 advocates have taken action. We've sent tons of emails over to the Hill in support of level funding for the PRC. So I'll just leave this up real quick. If anyone has their cameras, or you want to scan the QR code to take action. I will include this on our follow-up email, so it's just a click and you could take action there. So, but thank you to everyone who already taken action and has filled out the action alert. It is still growing, so I'm just really happy about that. Before we get to some of our upcoming events, I do want to mention that alongside our current action alert, you can go beyond just taking action on the alert, but you can also contact me to meet with your members of Congress. In the next few weeks, I'm going to be reaching out to some of our regional champions just to help them assist in planning a meeting with their legislator, either it's a senator or a representative in your local district. But if you're watching right now and you want to get more involved, I did put my email at the bottom of this slide, so you can always email me saying that you want to get more involved with our grassroots efforts. So you can email me, we can schedule a time to talk, and but basically at these meetings, you can just share your own personal story, lived experiences, advocate for yourself, the paralysis community, and for the Reeve Foundation. And I listed on the slide some issues that you can speak about, such as obviously PRC funding, air travel, and then caregiving. So let your voice be heard, contact me. I'm more than willing to talk to anyone. And I enjoy our conversations that I have with some past advocates and regional champions. So please, this is the time to do it, and you can let your voice be heard. So we'll go to the next slide. Some of our upcoming events, we do have an upcoming research advocacy webinar. So it will be happening on Thursday, February 22nd, 2024 from 4 to 5 p.m. Eastern time. And it's an educational webinar, which will discuss the importance of how to become an effective research advocate. We at the Reeve Foundation understand that spinal cord injury and the paralysis community face a lower level of engagement in research compared to other conditions like Parkinson's or MS. And we recognize the gaps in opportunities and knowledge, and know that there is a strong community desire to be involved with research advocacy. So my team, the Public Policy and Advocacy team, we're collaborating with Barry Monroe, who's from the North American Spinal Cord Injury Consortium. And we're going to strive to improve the comprehension of the research process and feature a detailed discussion about a new SCI advocacy course. It's free, it's online, and it was developed to empower individuals with SCI and caregivers to be well-informed and effective research advocates. So registration will be available soon. I'm going to put the registration in my follow-up email. And if you guys are watching and you want to come to this webinar, please, I encourage you to sign up. It's going to be a great one, lots of information, and I'm excited for it as well. But again, please check our events page on our website. New events get added each week, so you can always find the event there with the registration page to sign up. Next up, this is coming very soon, and it's right around the corner, but please consider registering to join us at the 2024 Reeve Summit. It will be held right here in Washington, D.C. at the Hilton on Capitol Hill from March 6th through 8th, 2024. Topics that are going to be discussed: advocacy, caregiving, employment, health and wellness, and research. So if you'd like to receive updates, you can go to ChristopherReeve.org/summit, or you can scan the QR code on your screen, left side of your screen, And any questions, I have the email address for our outreach and education team. So definitely it's going to be a really great summit. I'm very excited to be participating in it as well. And I hope to see you all there. Lastly, to wrap up this webinar, and before we get to some questions, just thank you to everyone who joined us today and joined our grassroots advocacy platform in the year of 2023. This year was just so wonderful, and I know we have big things planned for 2024. So I'm just very excited to be a part of this team and just to be speaking with our advocates on a daily basis. And so just get ready. It's going to be a memorable year. But now we've reached the end of our webinar. So if anyone has any questions, I'm going to throw it back to Kim if she wants to jump in to add something. But again, just thank you all so much, and Happy New Year.
Thank you so much. Oops. Thank you. My camera's not turned on. Thank you so much, Gerard, and to everyone on the panel. We appreciate everyone's attendance. And I see that we have one question from an advocate who's interested in connecting with our legislator. So Gerard will make sure you get connected to Carrie. Wonderful. Thanks, Carrie.
Thank you, Carrie. You'll hear from me soon.
So I think that closes our webinar. Again, we're so grateful for your participation and for your attention, and feel free to always reach out to us. And let's get ready for a great year. Thank you so much.
Happy New Year all.